Well, there you see a fine set of teeth, which happens to be my teeth. And we're with Dr. Karsten Lachman, who is, tell you, we've come a long way in dentistry since I remember sitting in a chair, something like this, and spitting into that old swirly sink. You've got lots of new technology. You use computers, you use lasers. What's the latest?
Well, basically the latest is probably what we call invisible braces. It's actually called Invisalign instead of traditional braces. Right. You're probably familiar with the metal braces.
Sure am.
Or even the white braces.
Right.
Those are traditionally very difficult to clean, uncomfortable, and not quite very aesthetic.
Right.
So these days, instead of using the traditional braces, we use clear plastic aligners.
Wow.
They fit right over top of the teeth, and they're removable to help make easy cleaning, and they straighten the teeth in a span of roughly 12 to 14 months, depending on the person.
Right.
And incredibly beautiful, and they work great.
What type of material is that?
This is actually a hard plastic,
right.
Very smooth and very durable.
And so you rid yourself of those nasty metal wires that people have and the look, and you probably don't even know that you're having braces done.
Exactly, exactly. You take them out to eat, you take them out to brush your teeth, and you wear them every other time.
And the success rate is just as similar?
Very similar. In some instances, they're actually better for certain cases. And actually, for the very, very difficult case, someone who thinks they can only wear braces, what we've done for some patients is they might wear braces for 6 months and then switch over to Invisalign instead of wearing braces for a full 2 and 3 years.
Wow. Now, we just looked at the computer-generated pictures of my teeth. Now, everything is on computers here. Explain what you have and how this all works.
Well, basically, yeah. When you first come in, we try to take pictures of almost every tooth in your mouth, so you see what I see when I look inside your mouth.
Right.
It becomes a lot more evident what may be wrong and what problems may be lurking. All of our X-rays are also on the computer, and that allows us to reduce the radiation by up to 90%. Because the computer is far more sensitive than film, we just turn down the radiation dramatically, and the pictures show up right on the computer screen, right in front of the patient.
Wow! So you see exactly what's going on. Patient sees exactly what's going on, and there's no mistakes.
I don't like surprises.
Yeah.
Basically, if I see something going on, the patient should see it too.
Now, if you're looking at those teeth there, what are you seeing?
Let's just leave it at that. No, you got a nice set there. We can work on that, but that's okay. Yeah. Everybody has their own smile.
No, okay. And you were talking about, actually, your assistant was telling me that I have a severe overbite or underbite, or what was that?
You have what's called a crossbite.
Right.
You would actually be well suited to Invisalign treatment.
Really?
Yeah, that can all be corrected, and no one on the air, or no one would know you'd be having braces done while you're on air.
Wow. What about lasers? This is the latest trend as well. Can we say it's pain-free, or is it less pain-free?
Basically, what I tell patients, I can't fix everything with a laser.
Right.
I will tell you if I can use the laser or not. And when I use the laser, yes, it is pain-free.
Right.
What patients have told me is the worst they feel is maybe a tickling sensation. And the benefit is that, first of all, the laser, nothing touches the tooth. There's no friction, there's no vibration,
wow.
And that means there's no pain.
So you can use a laser to fix, say, a cavity?
We can remove decay, exactly. We can use it for gum problems. We also have a different laser that we use to find cavities much earlier than was normally done with X-rays and such.
I used to hate that smell and that sound. So this is the laser right here, is it?
Exactly, yeah. Instead of the high-pitched squeal, the high-pitched whistling noise, this sounds more like a popcorn maker, like a pop, pop, pop.
Right.
And there's a little bit of fine water that comes out, so sometimes patients feel a little bit of a water spray, but really quite comfortable.
Sure. Now, what about people that just are totally afraid of dentists? I know that you do the another way of, getting them asleep.
Sure. We saw a lady this morning, actually. Some patients are terrified. Even with all these advancements, they're very quite apprehensive of coming to the dentist. And sometimes even a simple cleaning is not so simple for these patients. Right. So for those patients, we offer either laughing gas or complete sedation where they're totally asleep. We call it sleep dentistry. Right. And the benefit of that is they'll fall asleep in the chair. We do our dentistry, and then they don't hardly remember anything of the visit. They wake up at home, their teeth are fixed, they're fine.
So this is certainly the wave of the future with, less impact. There's a lot of, new things that are offered. You've got computers, and you even have things like this right here. You can watch a movie while you're getting done.
Yeah, these may look kind of dorky, but, they make actually life incredibly comfortable for the patient. When you're laying back, instead of seeing a blank ceiling, you can watch a movie right through these video glasses. The sound goes right into your ear. You can pick whatever movie you want. We have a selection here, and they work phenomenal.
Wow.
Just helps you not realize you're in the dental office.
So we're actually having fun going to a dentist for a change.
Yeah, imagine that, huh? Yeah, so it works really good.
What else do you see in the wave of the future in dentistry?
Basically, some of the real advancements come in what we call dental implants. People who've been wearing dentures for 5, 10, 20 years, they're really no replacement for their own teeth. And so they're having trouble with the dentures loosening. And so what implants do is they help to hold the replacement teeth in place, just like your own. And we can replace 1, 2, or all your teeth with implants.
Interesting stuff. Thanks very much for joining us, Dr. Karsten Lachman on the Global Noon Hour.
Thank you.